My name is Jeremy Beckworth, and we will be talking here about diabetes and peripheral neuropathy. I do want to give credit to nutritionfacts.org. I use a few of their slides, and they do give permission to do this as long as we give credit, and it is a fantastic resource, great website. So we are going to be talking about four things here: an overview of diabetes, helpful hints with diabetes, complications of diabetes, and the current clinical study related to diabetic peripheral neuropathy. So we're going to start first with an overview of diabetes. So if you had to guess, what percentage of the U.S. has diabetes or prediabetes? So percentage here in the U.S. with either diabetes or prediabetes, and the percentage is right around 50%. About 12% of people have diabetes, and about 38% of people have prediabetes. So you add those together, that adds up right around 50%. And if you had to guess the percentage of people who have prediabetes, the 38% of the population, of those folks who go on to have full-blown diabetes, and it's actually about 70%. So prediabetes and diabetes very common here in the United States. If you look at the different types of diabetes, there's type 1 and type 2. Type 1 is an autoimmune process that attacks the pancreas, the beta cells, and the pancreas does not produce enough insulin. So that's a smaller subset. Type 2, more common, is caused by insulin resistance within the cell. So this was a fascinating study from about 100 years ago. Back in 1927, in the Archives of Internal Medicine, they gave them a dextrose tolerance test. So they gave them a loading dose of sugar. They watched how their glucose reacted. And the 2 days preceding that, they divided students into two groups. One received a high-fat diet, the other group high-carbohydrate diet. So the fat diet, they received only olive oil, butter, mayonnaise made with egg yolk, and 20% cream. Those in the carbohydrate group were allowed sugar, candy, pastry, white bread, baked potatoes, syrup, bananas, rice, and oatmeal. And they did this diet for 2 days, then they gave them that dextrose tolerance test. So who do you think did worse, the high-fat group or the high-carbohydrate group? Well, if you look at the numbers, interestingly, it was the high-fat group here that had a higher spike in their sugars. It was quite notable. So the fat loading for 2 days prior, they did worse as compared to the high-carbohydrate diet, much less of a spike when they had the high-carbohydrate diet. So what was very interesting, there was a dose-dependent response that the higher the fat intake, in the darker colors here versus the less, the higher the fat intake, the higher the spike was in the glucose. The lower the fat intake, the lower the spike in the glucose. So there was a dose-dependent response. And so that was 100 years ago. Now, in recent years, many studies have shown that insulin resistance is now accepted to be closely associated with fat accumulation in muscle cells. So fat within the cells causes insulin resistance. And how does insulin work? Well, if you have an insulin receptor here on the muscle cell, insulin comes and binds to the insulin receptor. It then activates a number of enzymes, which then activates the opening of this glucose transport, which allows glucose to come into the cell. In the setting of a lot of fat within the cell, so these yellow particles are supposed to signify fat, the insulin comes, it binds the insulin receptor, but the enzymes that are within the cell are blocked, and it blocks the opening of this glucose transporter, and thus glucose cannot get into the cell. So it's really, again, fat within the cells that cause insulin resistance. It's also called intramyocellular lipid toxicity. And again, numbers of studies have shown this, that fat, that when it gets into the bloodstream, causes insulin resistance. It says we found that elevation of free fatty acid concentration caused insulin resistance by inhibiting glucose transport and or phosphorylation, with a subsequent reduction in the rates of glucose oxidation. And this has been further verified with NMR spectroscopy. NMR spectroscopy is like an MRI that's able to look within the cell at the fat content within muscle cells. And they found that the fat content correlated with insulin sensitivity. The higher the fat, the worse the insulin sensitivity. And it's been noted that after a single day of high fat intake, it reduced insulin sensitivity. So not only within 1 day, but within one fatty meal, there's insulin resistance. Within 6 hours, this paper suggested This suggests that even within 2 hours, you start seeing insulin resistance that peaks at 6 hours. So it occurs quickly. Within 2 hours, insulin resistance worsens with a high-fat meal. This stating the same thing as that last paper. They said within about 2.5 hours or 160 minutes, there was increased insulin resistance with a high-fat meal. So this was a study looking at overnight IV lipid or fat infusions in adolescent African American versus Caucasian young people. And before the fat infusion or lipid infusion, the muscle content of fat was low. After, it was high for both African American and Caucasian. You can see the increased fat content within muscle cells. And this correlated with reduced insulin sensitivity. So this correlates high fat, again, leading to insulin sensitivity worsening. And just the opposite happens. As you reduce fat within the bloodstream, you get improved insulin sensitivity. This was with a medication. And as the fat reduced, the insulin sensitivity actually improved. So the question is, does animal versus plant fat make a difference with insulin resistance? Well, saturated fat, which you find more in animal sources relative to the unsaturated fats, which you tend to find in the plant sources, appears to be worse on insulin sensitivity. So saturated fat appears to be particularly harmful for insulin sensitivity, again, which you find primarily in animal sources. And here's another paper saying the same thing. Ingestion of saturated fats decreases insulin sensitivity, and even with things like butter. Again, butter is high in saturated fat. The same thing was seen in the Adventist Health Study 2, which was a large NIH-funded 70,000 plus participant study where they looked at different diets and the prevalence of type 2 diabetes, from a meat-eating diet down to a vegetarian and vegan diets. The more plant-based they went, the less the risk of type 2 diabetes. Not only is fat bad for insulin resistance, but it's also bad for the production of insulin in the pancreas. Fat's been known to cause beta cell death. And the beta cells, again, are the cells within the pancreas that produce insulin. And here again, saying saturated fats are particularly harmful to beta cells. So the more saturated the fats, the worse it is for the beta cell function within the pancreas. So this is a graph looking at the gradual increase of insulin resistance in the years preceding diabetes. And you see how the fasting glucose gradually increases over the years until onset of diabetes occurs and it wears out. And they associated this with the pancreas wearing out. As fat got into the cells within the pancreas, the beta cells not losing their ability to keep up with the insulin resistance, and that leading to full onset diabetes. So does the type of fat, whether an animal or plant source, impact beta cell death? We looked at this earlier with insulin sensitivity, where saturated fat was particularly bad for insulin sensitivity, but how about at the beta cells within the pancreas? Well, yes, it does make a difference. So the palmitic acid, which you see here in the dark line here, which you find primarily in meats, dairies, and butters, cause more beta cell death. The oleic acid, which you find in plant sources, you see here, did not. And those are found primarily in things like nuts, olives, avocados, did not cause beta cell death. And lowering fat improves beta cell function within the pancreas and insulin production. So what causes type 2 diabetes? So in summary, the consumption of a high-calorie diet rich in saturated fats in the setting of an unfavorable genetic background is the cause of type 2 diabetes. It has been said that genetics loads the gun, but lifestyle pulls the trigger. So can you reverse type 2 diabetes is the question here. Well, the good news is for majority of people you can, with appropriate lifestyle interventions, weight loss, eating healthy. And this is an expert commentary that says that type 2 diabetes remains reversible for at least 10 years in most individuals. If you push it out to 23 years here, about 50% of those can still reverse it. So again, an overview of type 2 diabetes. Type 2 is the most common cause. 99.5% of people with diabetes have type 2, which again is an insulin-resistant issue. And it's caused by what? We talked about fat within the cell, which causes insulin resistance. We know that fat is bad, particularly saturated fat. And how quickly does it cause insulin resistance? Well, we looked back at some studies there that said within 2 to 2.5 hours, insulin resistance picks up, and it peaks within about 6 hours after a high-fat meal. So type 1 diabetes is an autoimmune attack on the pancreatic beta cells, which leads to lack of insulin production. And the question is there any benefit to eating healthy, whole food, plant-based diet with type 1 diabetes? And we'll come back to that. So that's an overview of type 2 diabetes. Now we're going to talk about some helpful hints, things that can be beneficial if you do have type 2 diabetes or type 1. So helpful hints, I'd encourage you to eat oatmeal, eat beans, and get some exercise. So this is from 1909 in JAMA, Journal of the American Medical Association. It says that no case of juvenile or adolescent diabetes should be deprived of the benefits of the oatmeal cure. So over 100 years ago, they were touting oatmeal as beneficial for diabetes. Here is a case report of somebody with severe insulin resistance in the ICU, couldn't get the glucose under control. And what they did, they put them on 2 days of strict oatmeal, just nothing but oatmeal for their diet. And the insulin requirements went down significantly. So from 205 units of insulin needed down to 42 units within 2 days. The glucose normalized from 246 down to 104. So marked improvement just with 2 days of a strict oatmeal diet. This is another report here. This is a case series of 15 inpatients with uncontrolled type 2 diabetes. First 2 days, they were on a standard diabetic diet. The days 3 and 4, they were placed on an oatmeal diet. They were allowed cinnamon and herbs were the only extra ingredients. And insulin requirements cut almost in half. And they said the benefits here of the effects of the intervention might last for several weeks, as shown by lower hemoglobin A1C levels 4 weeks after the intervention. Again, hemoglobin A1C is a measure of how your glucose is doing over a 2 to 3 month period. So this review stated that several studies have suggested that the effects could last between 4 and 6 weeks after oatmeal days. And what is the benefit of oatmeal? This is a systematic review and meta-analysis of the intake of oats in patients with type 2 diabetes. Well, it lowers your hemoglobin A1C, it lowers fasting blood glucose, it lowers your total cholesterol, and it also lowers LDL, your bad cholesterol. And what is the benefit? They think a lot of it comes from the beta-glucan, which is a soluble fiber. So soluble fibers are soluble in water. They form a gel-like substance. It slows digestion, helps lower cholesterol, helps stabilizes blood sugar. So gut bacteria fermentation of fiber has an anti-inflammatory effect. Researchers over the past decade here have shown that short-chain fatty acids derived from bacterial fermentation of dietary fiber have an anti-inflammatory effect, as can be seen in these couple of papers. So moving on from oatmeal to beans. Now we know beans, as the saying goes, beans, good for the heart. I'll let you finish that saying. But beans are particularly good because they have a low glycemic index. You can see here, when you eat beans, they have a lower spike in glucose compared to other food products. There's a slow release of carbohydrates that improves actually not only when you eat it, but the next meal after. As you can see here, if you had lentils for breakfast, has a low glycemic index, but even the next meal has a slightly less bump in glucose. This is another study showing the same thing. Test dinner with lentils or glucose the next morning. They're given a glucose breakfast, and there's a less of a spike after having eaten the beans the meal before. Exercise similarly has a blunting effect on glucose. Not only when you exercise, but even the day after, there's a blunting effect. So exercise can be hugely helpful. I'll mention one other thing is that eating meals late in the evening has been shown to increase your fasting sugars the following day. So earlier calories are better tolerated than late calories. So helpful hints: eat oatmeal, eat beans, and get some exercise. And I would also add in there, you try not to eat late meals because that has an effect the next day as well. And here's a study looking at a whole food plant-based diet, how there's a lower need for medications. The mean number of medications dropped, or the average number dropped from 4 to 1 on a plant-based, whole food plant-based diet. And you can see hemoglobin A1C levels, again, a measure over the last 2 to 3 months, your glucose. These individuals dropped as they went on a whole food plant-based diet. And this was a systematic review and meta-analysis that the consumption of a vegetarian diet is associated with improved glycemic control in type 2 diabetics. So the question is, can type 1 or type 2 diabetes be reversed? Well, as we talked earlier, type 2 diabetes can be reversed. Type 1 cannot be reversed. Type 1 is that autoimmune attack on the pancreas. But is there any benefit of a whole food plant-based diet for people who have type 1 diabetes? The answer is yes, and we're going to come back to that in just a minute. So we're going to talk about complications associated with diabetes. So what is the top cause of death in diabetes? If you had to guess, what is that? Well, the number one cause, as it is with other folks in the United States, it is cardiovascular disease, heart disease. And while you cannot reverse type 1 diabetes with diet and lifestyle interventions, you can address the underlying things that you will die from. And so heart disease, this is from images from the Cleveland Clinic, Caldwell Esselstyn, showing a diseased artery opening up after dietary interventions on a whole food plant-based diet where they excluded oil. So the complications of diabetes, I would suggest and argue that the underlying cause in most issues of complications with diabetes is an underlying vascular issues. We talked about heart disease. Cardiovascular disease is 2 to 4 times more likely in people with diabetes. Kidney disease, 30-40% of people with diabetes will get this. Again, if it's a poor blood flow, poor filtration of the kidneys that impacts it. Retinopathy, which is damage to the blood vessels in the retina within the eye, can lead to vision loss, seen in 90% of type 1 diabetes after 20 years, and about 60% of type 2 after 20 years. Again, it's a vascular issue. Diabetic peripheral neuropathy is seen in about 30 to 50% of people after 10 years. The underlying issue there, poor blood flow to the nerves in the feet. And many studies have shown that. High blood pressure, cholesterol, peripheral artery disease, foot ulcers, the majority of these things really have an underlying vascular flow issue. And this was a case series looking at kidney function on people with diabetes. That was a gradual decrease in their kidney function until they switched to a plant-based diet, and then it leveled off, and some of them actually did a little bit better. So going back to the question, is there a benefit for a whole food plant-based diet when somebody with type 1 diabetes? And I would encourage you to watch this video of Sarah on this YouTube channel, MedInfoLM. But she is a type 1 diabetic. She's in her early 30s. She's a nurse, and she's had poorly controlled diabetes since she was an infant with type 1 diabetes. And she would have to wake herself up every 1 to 2 hours each night for 30 plus years because her sugars were so poorly controlled. So she tells how she tried a whole food plant-based diet. She also excluded oil from her diet, and she says she thought it might take a while to have any kind of positive impact. But within the first day, she noticed that her sugars were normalized, and she could actually sleep through the night for the first time in 30 years without having to wake herself up. And interestingly, her need for insulin dropped in half. Now, she has type 1 diabetes, and so her pancreas is not producing insulin. And why in the world would she need to cut her insulin dosing in half? And the reason is likely because she had also some insulin resistance from a high fat within the diet. And so while you cannot reverse type 1 diabetes, you can have a markedly positive impact. And so I'd encourage you, she shares some even more positive information on this MedInfoLM YouTube page. Diabetic neuropathy, as we mentioned, 30 to 50% of people will eventually get that who have diabetes. So that's numbness, sometimes burning in the feet in the setting of diabetes. And what is the cause of diabetic neuropathy? I mentioned this earlier, but the underlying cause is poor blood flow to the nerves in the feet. So nerve biopsies, and a number of studies have shown this, that despite good glucose control, they've been shown to have small vessel disease within the nerve. So if you're getting poor blood flow, poor oxygenation to the nerve, it leads to injury of the nerve, which can lead to numbness and sometimes burning or pain. Again, another study showing the same thing, vascular disease as a cause of diabetic neuropathy. And another study, again, showing the same thing, vascular factors in neuropathy of the lower limb in patients with diabetes. So the treatments for diabetic neuropathy, I want to give you a little bit of a background. So we're doing a study in this. So the common things are medications, things like the anti-epileptic drugs like gabapentin and pregabalin, which is Lyrica, antidepressant medications, the SNRIs, serotonin norepinephrine reuptake inhibitors. Some of the older tricyclic antidepressants are used. The most common of these medications would be gabapentin or pregabalin. Those are the two most common of these medications for painful diabetic neuropathy. And the average pain reduction, you say, how effective are these things? Well, in the big studies looking at these things, there's probably about a 2-point drop in pain, where placebo, there's about a 1-point drop in pain. Although I will mention in these big studies, it's reported about 30% of people may get 50% reduction in pain. So for a subset of people, it can be very helpful, but on average, it's probably a very modest reduction in pain with some of these medications. Here's Lyrica and drop in pain scores at different doses, but the higher you get in these doses, you tend to have more side effects. And here, 77% of people who prescribed pregabalin, which is Lyrica, discontinued it by 1 year, either from side effects or due to lack of efficacy. It just wasn't helping. So the anti-epileptics like gabapentin, the most common side effects would be dizziness, 20%, drowsiness, swelling of the ankles, more so at the medium to higher doses of gabapentin, 1,800 milligrams a day. 7% described swelling, which was uncommon at the lower doses. Weight gain is possible, but again, more so at the higher doses is that seen. The antidepressants most commonly used would be duloxetine, which is also known as Cymbalta, but there's a number of other of those medications in this class of SNRIs that I had mentioned. And the efficacy probably at the more typically used doses about a 2-point drop in neuropathic pain for peripheral neuropathy. Side effects, medications with the antidepressants, GI side effects like nausea are common, high blood pressure, it affects norepinephrine, and so it can bump up the blood pressure a little bit. There's well-known sexual side effects like decreased libido, erectile dysfunction, that's reported at about 50% of people at the standard doses that are given. The older antidepressants like the tricyclic antidepressants can cause sedation, cognitive slowing, and sexual side effects in folks as well. There are other things. There are spinal cord stimulators that are used for peripheral neuropathy, and the data is pretty good for those with fairly notable improvement of painful diabetic neuropathy, but the follow-up, they only have 1 to 2 year follow-up, and so the how long it lasts is a question. Battery site pain is reported in about a third of people, and there's a potential risk for infection, and it is a little bit more of an invasive thing because it's an implantable, surgically implanted device that's placed in your epidural space. And the question, how long will it last? And so people ask, well, are there any other options for diabetic neuropathy, painful diabetic neuropathy? And if you can, the other question is, can you reverse diabetic neuropathy? And so if you ask Google, hey, can you reverse diabetic neuropathy? The answer is nope, there is no cure for diabetic neuropathy. But if you keep your glucose under good control, hey, maybe you can prevent the progression. But that is a thought, hey, there's no real reversal or improvement in diabetic neuropathy through any kind of lifestyle intervention. But if you look back in the 1990s, there was a study in a small journal that most people are not aware of. It was a case series that showed the regression of diabetic neuropathy with a total vegetarian or vegan diet. This was in a live-in program. Milton Crane, Clyde Sample did this. And what they did, they had 21 patients in a 25-day live-in program. And 17 of the 21, So about 80% of people had reversal of the painful neuropathy within 16 days. So that was a quick turnaround. Numbness persisted, but notably improved during the 25-day live-in program. And those who stayed on the program continued to do better. And what did they do? So they had a plant-based diet. They avoided meat of any kind, white or red meat. They avoided dairy, milk, eggs, oil, butter, sugar, or meat substitutes. So this was their diet. It was a plant-based diet. They did allow nuts, olives, and avocados as long as the weight was optimal for the height, according to the study. Exercise was at least 30 minutes a day or 2 miles of walking. So that was the prescription. And 80% of them, essentially their pain resolved within about a 2-week or 16-day period. There was one other case series that was never published. This was by Dr. DeRose and Dr. Charles Marcel. And they also did the same approach with the same impact. Now, I actually had a chance to talk to Dr. DeRose about this. But again, this was never published. It was presented but never published. So there's really one published case series suggesting marked improvement with a whole food plant-based diet, as I mentioned. Of note, they noted that the pain improved more quickly than did the glucose control, and they suggested it was likely from improvements in the vascular flow. So it was not a diabetic glucose control issue, but as they got better blood flow to the nerves, then the neuropathy got better fairly quickly. This was commentary on those 2 prior studies. But can vascular disease really be improved? Well, we know from the Cleveland Clinic, Caldwell Esselstyn, and in California, Dean Ornish, that 82% of people had improvement on repeat imaging with Dean Ornish, and 99% of people do better symptomatically, according to Esselstyn studies, from coronary artery disease. So you can have improvement. This is the image I showed earlier from vascular disease through lifestyle interventions and diet. There is one randomized controlled trial looking at a plant-based diet for painful diabetic neuropathy. And they did see improvements. I'm going to highlight this. It's a 20-week study. 34 patients were randomized either to a low-fat plant-based diet, weekly classes and support, and they limited the fat to 20 to 30 grams. So it was a low-fat diet, and the control group just got a B12 supplement, which was also given in the diet group. And what they saw, they did see an improvement in the McGill pain questionnaire, which dropped significantly. So that is clinically significant drop in pain. One of the other neuropathy screening instruments did have some improvement, which was not really clinically significant. And the pain scores, interestingly, they did not see an improvement compared to control. There's only like a 1.5 point drop in pain versus a 2 point drop in pain, which is very different than what was seen in those 2 prior studies that I mentioned that were a little bit older. This is a recent study. So why the difference? Why did Crane and Sample have 75, 80% of people, the pain was gone? And in this study, this randomized controlled trial, there was some improvement, but there was really, look at the pain scores, the 0 to 10 pain scores, there was really no difference compared to control, and only about a 1.5 point drop, 1.2 point drop in pain. So why are the difference? So we're going to come back to that in just a minute as we talk about our current clinical study. So what we're doing. So this current study is being presented at the International Conference for Nutrition and Medicine. If you know Dr. Neil Barnard, we are presenting it at his conference August of 2026. So our current study is a 2-month study where patients are randomized either to a whole food plant-based diet versus medical management with common medications like the gabapentin and Lyrica and such. If they get randomized to the medical management group, they can cross over into the diet group after 2 months. And what we're doing is a whole food plant-based diet, no meat, so no red or white meat, no dairy or eggs, no oil. Nuts, we will allow 1/4 a cup of nuts, about how much you feel you can put in your palm. We allow that, and 1 avocado per week is okay. So that's the what we are doing in our current study. So why no oil in our study? So what is the rationale behind that? So the only study showing reversal of coronary artery disease or vascular disease has been when they excluded oil, plant-based diet excluding oil. So Caldwell Esselstyn at the Cleveland Clinic, Dean Ornish in California. I showed you this image before. This is a stress test showing lack of blood flow to the heart muscle, this part of the heart muscle. Within 3 weeks, they were noticing improved blood flow to the heart muscle on their plant-based diet, but they also excluded oil. So we're just repeating what's been shown in the past in other published studies to reverse artery disease. And this was a more recent study as looking at adding oil to the diet of a plant-based diet. So when they added olive oil, which we think would be one of the better oils, it has a lot of good polyphenols, but when they added it to a plant-based diet, the total cholesterol bumped up 29 points, the LDL 16 points, and fasting glucose bumped up 15 points. So you can see here, total cholesterol bumping up 29 points, the LDL, the bad cholesterol, bumping up 16 points, and even the fasting glucose bumped up 15 points here. There was an older study by Dr. Vogel at the University of Maryland, looked at olive oil and how it decreased arteries' ability to dilate by 31%. The PREDIMED study was one of the large Mediterranean diet studies. It showed worsening of the carotid arteries with ultrasound. And you can see here, there's 3 groups. There's a control diet. There was a Mediterranean diet with added olive oil, and the carotid artery thickness actually worsened. The Mediterranean diet with added nuts actually had some improvement. And so there's actually worsening of the arteries with the olive oil in the PREDIMED study. And the 2 studies where they excluded the oil, the Crane and Sample, and the other one with Dr. David DeRose, they had marked improvement of symptoms, whereas the randomized control trial, there was really no difference in pain scores. And our speculation is probably because oil was not excluded in this study. So that's the rationale for what we're doing with our study. Now we know olive oil, 100%, any oil really, is 100% calories come from fat. Olive oil, 14% of the fat is saturated. So even though it's largely unsaturated, it still has 14% saturated. Interestingly, we did a small case series, myself, Drs. Vin Johnson and Christian Johnson, a PA that I work with, where we all did our fasting glucose levels, and then we did 3 days of 3 tablespoons a day of olive oil. And we checked our glucose before and after, fasting glucose levels. Interestingly, all 3 of us, 100% of us, we were normal glucose to start with. We were all in the pre-diabetic range after 3 days on the 3 tablespoons, which has been kind of a recommended number in a lot of the studies for the Mediterranean diets. So we're now currently about to start a study looking at 3 tablespoons of olive oil within a week to see how it impacts fasting sugar and other things as well. So can you reverse diabetic neuropathy? Again, Google and AI will tell you, nope, there's no cure for diabetic neuropathy. Well, here's what we have found thus far in our study. The orange line here is those who are on the medication management with things like gabapentin and Lyrica. This is the blue line is the diet group. So you can see a marked difference within 2 weeks, where the pain started up around a 6-7, down to about a 1 at 2-4 in 2 months, 2 weeks, 4 weeks, and 2 months. You can kind of see a clear difference, and it was statistically significant. We're still recruiting patients in this study, but a clear difference in the diet versus medical management. Every participant in the study reported at least a 50% reduction in their pain. That's the blue line here. Of those receiving at least 75% reduction in their pain, by 2 months out, 86% of people reported at least a 75% reduction in pain. So it is not mildly helpful, but markedly helpful. So in summary, an overview of diabetes, we know type 1 diabetes is an autoimmune issue. Type 2 comes from insulin resistance. That's really fat within the cells, intramyocellular lipid toxicity. And over time, the pancreas has a decreased production of insulin when there's increased fat within the pancreas. Helpful hints: eat oatmeal, eat beans, get exercise. You also want to avoid eating meals late, which can bump your sugars the next day. All major complications from diabetes typically have a vascular link. And lastly, diabetic neuropathy can be treatable. And I want to show the last thing here is a testimony of one of the patients that was in our study who's given us permission. You can see his video as well as others on the YouTube page MedInfoLM. Hey, Mr. Otten, good to see you again, and thank you for taking time to chat with us this afternoon. Could you tell us a little bit about your diabetes, your neuropathy, and this change in your diet?
Sure. Well, I started the plant-based diet towards the end of January, beginning of February. I was taking 130 units a day of insulin plus Jardians. Within 9 days of starting the diet, I was 100% off of the insulin, which means I didn't have to inject myself 5 to 6 times a day.
Wow.
I have peripheral artery disease. I've been in a wheelchair for spine issues, and as I got older, they got worse. I'm 75 years old now. Um, I noticed, probably 5 to 6 months after I started the plant-based diet, I was growing hair back on my legs again.
Wow.
Um,
Can I go back to the insulin? You said you're doing insulin, 130 units of insulin a day. You said within how many days were you off the insulin?
9,
9 days, because your
yeah,
sugars were dropping so low,
so fast.
so fast. Your primary care doctor said you needed to get off of it. Are your sugars better controlled now or when you were on the insulin?
They're a lot better. I don't get spikes anymore. I was getting spikes up mid 200s to 300s, and now most I've seen is like 155 to 160, and that's 2 hours after I eat, and then
Okay.
it drops down naturally.
Okay, very good. So within 9 days, you came off 130 units of insulin. You said you're not giving yourself an injection 5 to 6 times. You're saving money, you said, on that and some other medications you told me that
Yeah,
that is
three to $800 every 3 months, depending if I'm in the donut hole or not,
sure, sure, sure.
which I probably will never get in the donut hole again now because they had me on 2 types of insulin and Jardiance, and I take none of it now.
Very good. And so tell us about your neuropathy, how bad that was, and how much better it's doing now.
Okay, I had neuropathy up above the ankle. Um, it was very painful. And then you would get these spasms of pain, and I could be like driving a car and it would be in my, right foot, accelerator foot, and it was awful. Sometimes I'd have to pull off on the side of the road to let it pass.
Hmm.
And I'd get it at night, but it's gone completely since I've been on the diet. I'm not sure exactly how long that took, but I think it was like 3 months, maybe 4 at the most.
And it's completely gone.
It's gone completely. I
Okay.
don't, it used to feel like I was walking in sand. I don't feel that anymore.
Very good. Very good. Um, you'd also mentioned with your peripheral vascular disease, after some time, you started noticing something different with your legs.
Yeah, they were starting to grow hair again. As
Interesting.
you can see, I'm a hairy guy, and to have bald legs, I mean, it all happened when they identified my peripheral artery disease.
Yes.
This was years ago. But part of that, also, I should say, when I was young, I had a tree fall right across my lower pelvis on both legs.
Okay.
And the doctor that I originally saw, Hobson, said that could have had some effect.
Okay.
But like an idiot, I smoked for years. So I got peripheral artery disease. So,
Gotcha. So that's gotten better on this
oh,
diet.
yeah.
And you had mentioned for the last 6 years, you've been in a wheelchair
Yeah.
related to a few different things that you'd mentioned, but tell me about what's transpired there.
Well, on August 20, I started feeling a lot better. I mean, like on the plant-based diet, I weighed 186, 87 pounds. I weigh 145 pounds now.
Wow.
Okay, so I did lose some weight that also, I assume, reduces pressure on my spine.
Hmm.
I also was told by you and Dr. Johnson that the plant-based diet should increase circulation in my spine
Hmm.
and that I should have a increased mobility. So on August 20th, I got out of the chair and I haven't gotten back in it. It's been 65 days. I
Wow.
count every single day.
That's great. So you've been in a wheelchair 6 years. Last
Yes.
65 days, you've not used a wheelchair. You've been
Nope.
walking, getting around. I remember
Yep.
you saying just like to get in a shower, it was hard to stand to get in a shower. So you're out of that wheelchair last 65 days. And you'd also mentioned something with your kidney disease.
Yes, I had stage 3 kidney disease. It appeared to be largely from the medications I was being prescribed because as soon as I got off of the hydrochlorothiazide and the Jardiance and the insulin, I'm down to like stage 1 or stage 2. My function kidney function is well in the normal range.
Great. That's fantastic.
Yeah, it's all the diet.
Yes. So any other thoughts here that you want to share with anybody on this plant-based diet? Has it been hard to do, easy to do, or any other comments?
Well, I love salads and I like vegetable soup. Mary makes one that is fantastic. Um, I went out and bought all the recipe books and what's that oven called? The pressure cooker.
Oh yeah, Instant Pot. Yes.
Yeah, I bought an Instapot. I don't have any problem with it because to begin with, I love salads. I love fruit. You can eat as much as you want all day long with salads and fruit. You are not going to get sick, you know?
Yeah.
So, for anybody who's having these problems, especially diabetics, you really need to get on the diet. It's not that hard. If you have circulation problems, you have to cut out the oil too. And that can be difficult because when you buy stuff at the store, you really, if there's less than, what is it, half gram or something of oil, they don't have to list it. So it's a little more difficult to do that. But I'm 75 years old and I'm walking. I walked up a hill today coming out of downtown Hendersonville. I couldn't do that for 10 years. It's well worth doing it. You got to give it a try, but you got to really try. You got to dedicate yourself to it. And it's cheaper than buying steaks and pork chops and all this stuff
Uh,
and processed foods like cold cuts. I mean, we shop in the vegetable aisle now. Pretty
nice.
much that's it. And the Ezekiel bread.
Ezekiel bread. Yes, yes,
You,
very good.
you have to
Well,
watch the bread, but if you want to get well, do it.
give it a try. Well, thank you so much for sharing.
All right.